KURINJI Senior Secondary School, CBSE, Namakkal.
Successful result producing school in state every year.
Administered by the Board of Directors with over 35 years of experience in the teaching field.
Special attention on art, craft, music, dance, silambam, yoga, skating and karate.
Focus on Hindi Sabha and Spell Bee Olympiad exams.
Smart class for effective and innovative learning and well-furnished library.
Solitary importance on sports and games in state and national level.
WhatsApp facilities to know activities of students and school inside the campus.
NEET, JEE, IIT coaching experts from Rajasthan and Andhra Pradesh along with our effective teachers.
Admission registration for classes LKG to +2.
KURINJI Educational Institution, Kavetipatti, Namakkal. Admission in progress. CBSE, KG to 12, contact 9025895176. Metric 6 to 12, contact 9344567484. For online admission, log on to www.kurinjischoolnkl.in.
Hi students, good morning to everyone. In this video, a conclusion topic of body fluids and circulation. Here we are discussing about different disorders of circulatory system of human being. ಇದಕ್ಕೆ ಮುನ್ನಾಡಿ video I explained about hypertension, nothing but BP. Okay, apart of that remaining what are the disorders is given in our syllabus that we discuss. Especially in this video you will get clarity about ECG. Okay, that is electrocardiograph or electrocardiogram. What is the significance about to identification of heart related disorders? How that ECG helpful for find out the malfunctioning of heart, disorders of heart. Okay, it will give a proper identification how our heart is function. Okay, let me know about our today topic. So start today video session. Scene na paranga board first column disorders of circulatory system. Yesterday you get clarity about hypertension, why we are getting BP. The normal healthy person BP 120/80, it is systolic and diastolic pressures kadanna. If it is cross 140/90, we called as considered as a hypertension. Okay, with the help of the sphygmomanometer, one instrument, based on that we will count it. We can able to measure whether that person suffering with the hypertension or not. That will be causing by the some of the smoking and then taking of salt intaking more quantity. These and all some reasons for causing of the hypertension. Now come to the next one, coronary artery diseases. By hearing of these side heading, you will get idea about why these disorders came and in which part of a heart getting trouble. Coronary artery disease. What is the meaning of the coronary artery? Artery means which is the blood vessel supplying the oxygenated blood to some part, that is the artery, body part. Okay, so here that artery to supply the oxygenated blood to coronary. Coronary means heart. So which blood vessel supplying the oxygenated blood to heart walls, that artery affected. Okay, by the some of the things. So by that coronary artery disease will come. Shortcutly it called as a CAD, coronary artery disease. Why it is called? Basically this is we called as a atherosclerotic heart disease. Atherosclerotic heart disease. Okay, then it resulting, why it is causes, reason, then here the coronary artery disease is causing by the accumulation of the calcium what we take in food in our heart muscles. If it is accumulated lot of calcium in the heart muscles, and then fat, and then cholesterol and fibrous tissue along the wall of coronary artery. Now think it, nana, any artery or any blood vessel, it is a supplying of the blood that with the help of the wider narrow place, lumen place. If that narrow wider range human place is filled with any accumulating of these substances. Already I said calcium, fat and cholesterol and fibrous tissue on the coronary wall, coronary artery wall, still it continue, still the reducing of their width of the lumen, correct now. So now heart wall does not get proper oxygenated blood, okay. So here that will leads to the oxygen deficiency. So when the oxygen deficiency happens in the heart muscles, it causes to the problem to the heart, and then if the heart is getting problem means automatically remaining all organs are getting problem because of heart only pumping the oxygenated blood to the different body parts. Lack of proper function of the heart, automatically remaining all organs are not yet get sufficient oxygen, okay, whatever it is. Now here these coronary artery disease affected by the accumulation of the calcium, fat and cholesterol, fibrous tissue in the coronary artery, okay. That coronary artery walls are there now. Yesterday we seen arteries or veins are made up of the three layers, tunica externa, tunica media, tunica interna. These layers is inside it accumulating out these cholesterol, fat and so already I said the width of the lumen is becoming more narrow. So along the wall of coronary wall makes the lumen narrow, that only now I said. So when the lumen is narrowed of blood vessels, it reduces the blood flow, to heart. So heart will not get a proper oxygen, blood. So it causes the ischemia. What is ischemia? Here in the bracket I mentioned restriction of the blood supply to the muscle tissue. Which muscle? Cardiac muscle, causing the shortage of the oxygen. So here that muscle tissue contains the what cells? Myocardial cells now. That myocardial may be die, that we call as a necrosis. In botany also these word will come, necrosis means cell death. So a forcible cell death, that we call the necrosis. So lack of proper oxygen supply, the myocardial cells will die due to the lack of oxygen, okay. That leads to the myocardial infraction. These heart muscles will damage. That only here a particular place of the muscle tissue is damaged and that part cannot receiving the nerve impulse, electric impulse, lack of taking of nerve electric impulse, heart can't show proper contraction and relaxation. So heart muscles are damaged. So finally it leads to a drastic problem. So it causing by the smoking habit, and then diabetic patients also maybe will getting problem, and hypertension persons also this will be getting problem, okay, this type of problem, okay. What I said, coronary artery disease is also called as a we can able to consider as a osteosclerotic heart disease. Then it resulting of the accumulation of the calcium, fat and cholesterol and fibrous tissue along the wall of the coronary artery. Then it makes the lumen narrow, blood vessel lumen narrow, artery blood vessel lumen narrow, by that effect reducing of the blood flow to the heart. So it causes to the ischemia. Ischemia means a proper oxygen is not supplying properly of the heart walls. Heart walls are heart cells, cardiac cells, cardiac muscle cells, myocardial cells maybe will die. So if it is died means it causes to the myocardial infractions, okay. That finally muscle will damage, heart muscles will damage. That is the first one. And then angina pectoris. Here angina pectoris, it make a chest pain. It is a normal indication of a heart something affected. It is not major problem. It is not a major, angina pectoris is not a major problem, but it is an indication of our heart is something affected or something malfunctioning, or maybe will soon heart will be affected by the some of the dangerous diseases. Okay, that is the thing. So angina pectoris make by the chest pain, marked by the chest pain. How we can able to predict these angina pectoris? Here which patients are affected by the angina pectoris, those patients oftenly will get chest pain. Okay, by the narrowing of the blood vessels. What is the reason for that? Narrowing of the blood vessels, nothing but equal to the ischemia. But what is the differences between the angina pectoris and then here these coronary artery disease? Here coronary artery disease wise heart tissue will damage. Heart tissue will damage, sometimes it is necrosis, cell death will also here may due to the die of the due to the lack of oxygen. But here angina pectoris time it is not yet having anything necrosis, not yet having anything necrosis. That mean still that all the heart cells, myocardial cells or everything is a functionative. There is no any damaging of the cardiac tissue, so no necrosis. So this is a general. So this is a very common in the middle age. So who are more stressful work they are doing, or more some of the when the people are crossing the 35 years to 40 years crossing after, the maximum people will get this chest pain because of based on the age related, work related. Okay, so middle age people will be affected by these angina pectoris. That is the indication, is one of the thing heart is something problematic situation. Okay, so here it has also leads to the something smoking and diabetes, high cholesterol. How, what is the reason cholesterol is a play an important role? Means the cholesterol will be deposited on the blood vessels. So blood vessels diameter, human diameter will decrease. Automatically heart walls does not get a proper oxygen. Lack of heart not getting proper sufficient oxygen, heart functioning, contraction and relaxation is not performing well. Lack of proper functionative of contraction and relaxation, remaining all organs are not also not yet get sufficient oxygen. So it is a link between all the organs with the heart. Okay, so angina pectoris means it is not a major problem like a coronary disorder, coronary artery disease. But angina pectoris is an indication in soon, maybe in future, with the patient will be get heart related diseases. If the patient will find out these situation, if he take a proper medicine means proper treatment and then proper exercise, these and all, we can able to restrict that further disorders of heart. So that is a angina pectoris content. Then heart failure, it is a very problematic to the patient. Here maximum in our daily life we are hearing these word oftenly. Who are crossing the 50 years, that age people will be getting the sometimes suddenly heart failure. So what will happen means the heart lose their ability to the sending of the blood to different body parts. That is a major essential work now. So lack of that proper work, when that heart not yet able to perform that work, so it will leads to the death also. So I mentioned that only. Heart failure, heart unable to provide the sufficient pumping action, because of heart want to show contraction of atriums and contraction of ventricles. Ventricle contraction time only blood will be pumped out from the coronary arteries and pulmonary arteries, correct na? I mean nothing but aorta, pulmonary aorta and systemic aorta. So here heart failure time, what will happen means that heart contraction and relaxations will not happen properly. So it is disturbing the blood flow to supplying of body parts. So disturb the blood flow meet the need to the body parts. So lack of a sufficient contraction and relaxation of the heart functions, body parts will not get a sufficient blood supply. Okay. But here we want to understand one important differentiation between the heart failure and cardiac arrest. Here heart failure, it is not a sudden effect. Okay, it is a different stages onwards it will be causes. Nothing but here coronary artery disease is there na. First coronary artery disease initiated by the, you think like angina pectoris, that angina pectoris leads to the coronary disease. If the coronary disease is continuous, if that patient will not find out that disorder, this disease thing, then it will be leads to the heart failure. Okay. Now when the heart failure time, it is indicates several signs to previously, okay, in the different situations, but cardiac arrest is not like that. Cardiac arrest means heart is well function in the all the time. Whatever it is, age is not a matter. Heart is well function, he is a good healthy situation, but unfortunately a particular time heart to stop the pumping. Okay, why? What is the reason we can't say? What is the reason of the heart cardiac arrest we can't say? Okay, because of heart is well function up to that minute, but unfortunately a particular situation heart is stop that their function. So 5 minutes, the 5 minutes all organs are not yet get any oxygen, lack of oxygen supply, patient will die. Now I am giving some clarification to you for about regarding the cardiac arrest. Abdul Kalam died by the with the this disease only, cardiac arrest. Okay, up to that minute Abdul Kalam is something speak with some of the students. Okay, unfortunately in that particular minute the Abdul Kalam is fall down in that speech movement. Okay, and that time Abdul Kalam faced this problem, cardiac arrest. Okay, before that Abdul Kalam does not have any heart related problems. Okay, that is the differences between the heart failure and the cardiac arrest. Heart failure having the several stages to find out, but cardiac arrest does not have any signs, unsudden arrest of the heart. That is the thing. Okay, so these are the different disorders of the circulatory system. Okay, now recent generation, I mean from the when the technology is improved, the heart related disorders find outing wise some of the technology is available in the market. In the technology oftenly we are using one technique, that is a ECG. Okay, that ECG we call as a electrocardiogram. Based on that ECG, on one paper one graph will become, that graph we call the electrocardiograph. Okay, you know, you are all oftenly hear these technique means these diagnostics technique, because of in your houses some of the aged people are if anyone any health problem wise or health checkup wise he went any hospital, first they will be suggested to the just check it our heart function whether it is good or not. They are suggested to the take ECG. How they will be used, how it is used to find out the heart functions, whether heart function well or not, that you will get it clarity in this concept. Okay, then see in the ECG electrocardiogram by that electrocardiogram technique graph will be produced. That only how graph will become, how heart functioning onwards they graph. Here when the patient went to that technical diagnostic center, that technician will be kept the 9 electrodes, 9 bubbles. Okay, that electrodes keeping in the different places of our body. On hands 2 are belongs to hands, 2 are belongs to legs, and 2 are belongs to chest. Okay, some different places. Before fixing of that one, they are using the something one gel, then they are fixing out that electrodes will be take out the electric impulse of the heart. So that only here I mentioned the first point, produced for the recording of the electric charges in the heart. Sir, how heart containing with the electric charges? Whether you remember or not, recall cardiac cycle. In the cardiac cycle time, sinoatrial node is generate the action potential. Action potential nothing but electricity only na. By that electric potential, that the impulse will be transformed to the AV node, atrioventricular node. Then onwards, the bundle of his onwards, Purkinje vessels, totally heart will get the electric impulse by these nodal tissues. So that electric impulse are recording by that electrodes. I remember that one. I think you seen several movies also how the ECG is taking. Okay, one computer based one graph is there, that they will take one paper print also. So that paper print indicates the electric impulse of the heart. So here graph recording, it's containing several waves. When you seen that cardiograph paper, the paper containing graph, already you in the study wise you draw the graphs on the graph sheet like that. It contains several waves. So that waves are indicates heart diseases. I mean, a healthy human being heart functioning waves are one type. If the heart is malfunctioning or anything affected by the disorder, that heart will be affected, show the something different type of graphs. So see here, these electrocardiograph containing with the waves related to the electric impulse during the cardiac cycle. Here cardiac cycle contains the three steps regarding our test book, but we can say the four steps. First one, joint diastole. All the atrium ventricles are relaxed condition. Next one, first step of cardiac cycle, that is the atrial systole, then ventricular systole, and then cardiac diastole. These are the four steps. In this time, electric charges are oftenly will change. Okay, so how it will change? By the regarding the using of the electric charges, we can say three different words. When the heart is relaxed condition, on the time, that condition we call the polarization stage. Now when the heart is contraction, that is indicates a depolarization stage. Then depolarization stage onwards, heart will getting a polarization stage, that we call as a repolarization stage. Repolarization means nothing from, again it will get their own position from the depolarization to polarization. That process we called as a repolarization. So this polarization word indicates the electric impulse charges. Okay, in the which time what are the polarization conditions will be the causes in the heart contraction time. So here inga paringa pointer place, this is the representation of a cardiograph. Already I said cardiograph containing with the different waves. So here when they are fixing the electrodes to that patient, that electrodes receiving the information, electric information, then totally it is giving to the in the image on the computer, and then simultaneously providing the one printout. So here that graph containing the one P wave, and then Q wave, and then R wave, S wave, and T. So P, Q, R, S, T, these are the different waves we can find in the electrocardiograph. So sir, why you are saying these waves? What is the link between these waves and then heart functioning? These waves only indicates heart function of cardiac cycle. How? See, already here in the pakka paranga, first one, waves P, Q, R, S, T waves are there, and then intervals are there. Intervals means a gap between the two waves. Intervals means a gap between the two important waves. Here two, one is P to R, P to R interval, another one R to R, Q to T. This is the Q, this is the T. So Q2 interval, and one more interval R to R. R to R means one complete cardiac cycle to, and then another completion of another cycle of the cardiac cycle. What is the time gap? That R to R interval tells about a gap between the one complete cardiac cycle to another cardiac cycle. Okay, so this is the thing. And some of the segments also is there. That segments, it is segments means in between of two waves gap. in between the two waves. So after one wave completed, after another wave will start now. So end of that one wave and beginning of that one wave, the gap between the two waves, that we call the segment. Here ST segment and PQ segment or PR segment, these are the segments. So electrocardiogram containing with the waves, intervals and segments, that you should be remember, maybe chances of one of the MCQs question. Okay, so what is the link between these waves to heart function? P wave indicate atrial depolarization. Atrial depolarization means atrial systole. It will take 0.1 second. And PQR complex indicates the ventricular depolarization, ventricular contraction, that will take 0.1 second. And then T wave indicates the ventricular repolarization. Ventricular repolarization means cardiac diastole only, totally 3 steps only in the cardiac cycle. First one, atrial systole, atriums are contracting. On the time that electric potential, we can able to say in the atrial depolarization. That means resting stage onwards, it will be going to the something activational stage, forcible contraction of atriums. By the forcible contraction, blood will be pumped into the appropriate ventricles. So ventricles, again ventricles want to contract. That ventricle contraction can able to symbolic to the QPR complex. That QPR complex indicates ventricular depolarization. Depolarization is nothing but contraction. That contraction time, blood is pumping by the arteries, pulmonary artery and systemic artery. So blood will be pumped out. Then adikaparam next T is indicates ventricular relaxation. Sir, you didn't said about atrium relaxation. When the ventricles contraction time, atriums are simultaneously, it will be relaxed condition. Okay, I think so. You got the point. These P wave indicates the atrium contraction. QRS wave indicates ventricular contraction. These T wave indicates ventricular relaxation, depolarization. So contraction nothing but depolarization. Okay, and then relaxation indicates repolarization. Okay, in the normal resting time, it indicates a polarization stage. Okay, now this is the graph. Now based on these graph, what we can find? For example, here each and every wave, how much time to produce, within the which of the time, within the which time of the seconds, the wave will be generated. Okay, maybe sometimes that time gap is more, or maybe sometimes time gap between the two waves may be very less. So based on the time duration of the formation of these waves indicates the problems of wave heart. See, that only here I explained. If the enlargement of the P wave is enlarged, if enlarging means it will take something long time, correct na? So generally a healthy human being P wave indicates 0.1 second. So if the prolonging means it will more than 0.1 second. So that will tells about something atriums are enlarged. Atriums are enlarged. So if the atriums are increasing their size, automatically contraction wise it will take long time na. So that P wave indicates something problem in the enlarged in the atrium. That is the one thing. And then variation in the QRS. If anyone find out the graph, in the graph QRS complex variation vanditna, that will indicates the bundle of his is something problematic. Why means QRS indicates the ventricular contraction. Properly ventricular contraction is not yet happens. So something problem, because ventricular contraction controlling by the supplying of electricity with the help of the bundle of His and Purkinje fibers only na. So the second point, variation in the QRS complex indicates the bundle branches are blocked, either bundle branches and then Purkinje fibers, and then PR intervals. PR adanna idi kadana PR interval. Interval means a gap between the one wave middle to another wave middle. So here PR interval prolonged, adanna it's delaying the conduction of the nerve impulse. That means generation of the potential, action potential from the sinoatrial node, it is very slow. So for heart functioning is very slow. That only here, sinoatrial node onwards, conduction of the nerve, electric impulse, not nerve impulse, electric impulse are very slow. That is a mark indicated by the PR interval. Okay, and then here if heartbeat for 1 minute for a healthy human being approximately average 72 times for 1 minute, correct now. So sometimes it is more than 72 times, up to 80 also no problem, 85 also not a problem, it is a situational, depends. But continuously the person heartbeat is continuously beating in the more than 90, more than 80 means it is a problem. Okay, at particular situation, angry or any situational time, running time, heart is beating some more time means that is not a matter. But when we are getting more pressure, feel something more pressure, it causes to the high BP. That high BP leads to the heartbeat functioning more. Heartbeat rate will increase. For 1 minute, it beat to the up to more than 72 times. So it is in future it may be problem to the heart. It is not at a time, it is not a problem. Maybe in future it is continue. Nothing but our heart also one mechanism, one mission. That mission work for the purpose of the pumping of the blood to the our body parts. Unfortunately, if you consider as our heart is a mission as a mixie, we are using the mixie is a proper way. It is not a matter, but continuously we are rotating that regulator 1 2 3 1 2 3 1 2 3 1 2 3 means within 1 day it will be ruptured out, damaged out, like that. So fastness is a very problematic. In this situation, one of the thing can be explained in our human, in the total animal kingdom, tortoise having the very long lifespan. It may be live up to 300 years. Why tortoise have that much of very long span mean? Tortoise heart will be beat for 1 minute 12 times only. So which of the persons regulate their heartbeat to control, those persons will be having the long span. Now you have the one doubt, sir. Now you said a cardiac arrest, na? If the suddenly cardiac arrest will come, na, the person will be alive, na, sir. Cardiac arrest is a exceptional condition. Okay, so that is the thing, Nana. Here our heart will be beated very slowly, that we call as a bradycardia disease. Heart will beated very fast beating of heart, that we call as a trachycardia. These bradycardia, trachycardia, these and all we can able to find out with the help of the ECG. Still some of the uses regarding ECG we have. That and all we will discuss in the NEET syllabus. Okay, right. In the next I will continuation with some other new chapter. That we wait for new chapter video. Thank you.